Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
Go above and beyond.
they become very good at what they do, but only
0.1%.
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
With Richard Jacobs.
Hello, this is Richard Jacobs with the Finding Genius Podcast. I have Lahari Rampur. She's a clinical assistant professor in the Department of Medicine, Division of Allergy and Infectious Diseases at University of Washington. And we're going to talk about allergies and immune disorders. Lahari specializes in treating disorders like food allergies, drug allergies, seasonal allergies, asthma, insect allergies, etc. Lahari, thanks for coming.
Thanks for inviting me, Richard.
Yeah,
Glad
so
to be here.
is your work mostly clinical, seeing patients, or are you doing research as well?
I do mostly clinical work, but I also do some research in terms of antibiotic allergies and helping the institution coming up with the right protocol to treat patients with antibiotic allergies.
So these are antibiotics you take when you get sick and people develop allergies to them?
Yes, many people have a history of allergic reactions to penicillins and various antibiotics. What happens is when they get hospitalized, because of their history, people need to get alternative antibiotics, which may not be the best thing to do because they're more expensive at times. They can cause side effects. So it's important to really choose or identify who are actually allergic and who are not. So in those situations, we need certain type of protocols and guidelines and to see who are really allergic. This is part of antimicrobial stewardship, where infectious disease specialists and pharmacists are involved, and I also have a role to help develop guidelines and protocols in the institution. That's what I meant when I said research.
Okay. So what happens when somebody gets an allergy to an antibiotic? I mean, is it a real serious acute type of thing where they have to quickly help the person, or what happens to people in general?
So there are different types of allergic reactions. Yes, people can have severe reactions like anaphylaxis. People can get hives and swelling of their throat and breathing difficulty. They can faint, and people can even die. Fortunately, it's not very, the mortality is not very high, but people can have a severe reaction. The other types of severe reactions are blistering skin reactions. Sometimes it can also affect your organs like kidney and liver. Those type of reactions are rare as well. But the most common type of reactions are rashes and having flushing and itching type of reactions. They're pretty common to different medications.
So what's to be learned about these allergies so far? Are there commonalities, or does it seem to be very person specific?
They're person specific, but in my experience, most of the people who had a specific allergy many years ago to any antibiotic are eventually able to take it. About 10% of the population patients that we see report some type of drug allergies, but more than 90% are able to take it. So most are mild, and we can eventually introduce the same antibiotics that they were allergic to. Sometimes after testing and sometimes even without testing, just based on the history of mild or minor reactions.
Are you correlating, let's say, someone's microbiome with an allergic reaction? Is that being studied?
Yes, there are a lot of studies on microbiome and how having certain type of microbiome predisposes you to develop allergic conditions. May not be specific allergy like peanut and other foods and specific drug allergies, but overall, the tendency to develop allergies in the future, like eczema, asthma, and seasonal allergies. This is it's called the allergic march. So people have studied about microbiome, which influences one's tendency to develop allergies in their life.
All right. So what other kinds of allergies you run into most of all? Is it asthma or food allergies?
Yes, I do see different types of food allergies. whether it's a minor allergy or a severe type of anaphylaxis to various types of food, drugs that I already discussed. We also treat patients with bee sting allergies, help do skin testing and evaluate them further. And we do see seasonal allergies, environmental allergies, like pollen, mold, dust mites, cat, dog, how this also affects asthma, and we help treat patients with asthma. And we also treat patients with skin disorders like contact allergy. We can do patch testing to help them with to find out contact allergens, and we treat patients with eczema. So these are the type of allergic conditions we treat.
So what's the new science saying about some of these allergic conditions? Where do they come from? What modulates them?
It's your genetics. If you have a family history, if your parents have allergies or asthma, you're much more likely to develop allergies. But there is also an environmental influence on genetically predisposed person. Let's say you're exposed to a lot of dust mites and maybe pollution, smoking. Maternal smoking has also been studied as a correlating factor for development of allergies in kids. So there are various factors. Genes are the number one reason. You're genetically predisposed, but there are also environmental influences.
Well, if genetics are the main reason, why would people develop allergies or over time lose their allergies? That would
Correct.
be epigenetics at best, right?
Yes. That's what I meant to say. Environmental influence on genetically predisposed people. Epigenetics also play a huge role.
So what are the most urgent allergies to look at? Which ones are, let's say, either on the rise or really prevalent that need to be addressed?
So these days, food allergies becoming more common for reasons which are not very clear. Maybe it's a hygiene hypothesis where people studied kids in Europe, people who were living in the farms. They have lesser amount of allergies compared to people who are living in the urban areas. I don't know whether it is the hygiene hypothesis that is being studied, whether it's the microbiome. So food allergies have been on a raise. And asthma, severe asthma is another allergic condition that needs to be addressed, especially in inner city population.
So what's being done? Is it really important there, therefore to sequence someone's genetics when they have an allergic reaction, and then maybe sequence their whole family, or like what's the protocol where you could quickly figure out what might be going on with someone and what to do?
So typically we don't go into genetics when it comes to allergic reactions. We simply try to find out what they might be allergic to so that we can help them better, maybe to avoid or even to desensitize or recommend immunotherapy to certain environmental allergens that they have. We typically don't test the genetics because even if you find out where it is coming from or why they're having, you're not able to change that part. Hence, we don't typically do genetic analysis in people with allergies. It's for immune deficiency and immunological disorders, we consider genetic studies, not so much for allergies.
But if someone has allergies, what do you do to treat them then? If genetics are a big role and then you don't look at their genes, how do you treat them effectively then?
Okay, so let's say somebody went to a restaurant, had an allergic reaction immediately, like hives and lip swelling, they're not able to breathe. They ate 10 different types of things. We ask them what exactly they ate, and we test them for those things that they ate. And if something stands out or comes back significantly positive, we can tell them, you came back positive to fish or shellfish or something that they need to avoid. So they can be careful and look for ingredients. So when it comes to pollen and dust mites, some people really do suffer and have a poor quality of life in the season or throughout the year with headaches and sinus issues and whatnot. If we find out that they're positive to, let's say, pollen or dust mites or pet dander, we can give them allergy shots. So we mix the things that they're allergic to and we keep giving in the form of shots to reduce their sensitivities. We train their immune system to not to react the way it was reacting. Or we can also recommend some dust mite control measures, which are proven to be beneficial in patients who suffer with dust mite allergies. So each person is different. When it comes to anaphylaxis to bee stings or any type of insect stings, the chances of having a severe life-threatening reaction in the future in a patient who has had a history of severe systemic reaction is very high. So in those patients, we test them. If they're positive, we can also give allergy shots, which significantly reduces their chance of a future reaction in the future if we start them on the shots.
Oh, why do allergy shots work? How do they work, and what do they do?
So allergy shots are a way of treating. It's a way of training your immune system, converting them from allergic to non-allergic type of cells through release of various types of chemicals called cytokines. So there are allergy-causing molecules. There are molecules or cells that build tolerance. So it's slowly deviating the immune system from being allergic to non-allergic.
So if you were able, if you were, I mean, I'm not saying to do this, but if you're allergic to something, could you expose yourself to like a minute amount of it, every day, and slowly build up more and more of it until you're immune to it?
If you had a real, significant allergic reaction to something, we wouldn't advise doing that because there is risk of developing an allergic reaction. We sort of do it in a controlled setting and with precisely calculated doses of allergens. Since you cannot control that at home, I wouldn't do that. But for pollen allergies, I know people talk about local honey and things like that. I think it's one way of developing tolerance to pollens if you're allergic to any. People do that, but for food allergies, I wouldn't necessarily recommend doing that at home.
Well, it could be so dangerous that you could,
Correct.
easily knock yourself off. Okay, gotcha. So what's the difference between a pollen response or a dust mite or mold and a food allergy? Why do food allergies seem to be so acute and so strong?
So there are different types of cells that are involved, whether it's airway or in the gut. So when you're eating an allergen, the way it is processed and given to the immune system is different compared to way it is processed and given to the immune system in the airway. And the cells that cause an allergic reaction, like mast cells and basophils, they are also a little bit different when it comes to airway and the gut. And that's why it can be a different type of reaction. Okay,
so do people tend to have allergic reactions both ways? I mean, you're not eating pollen, but in a way, maybe not even minute amounts, I guess you're not. But what if you have a food allergy? Can you, let's say it's the peanuts, could you, I don't know, smell some volatilized peanut essence and build up a tolerance that way? Would that be a safer way of, getting you used to it instead of like eating a minute bit of peanut? Like, how have protocols been developed to get people over really bad allergies, if at all?
For peanuts, we have peanut patches and sublingual tablets. They are extensively studied these days, and people are using these to develop tolerance to peanut allergies, but not. I'm not aware of anything that can cause tolerance through inhalation. I don't think that's being studied.
Well, I guess it wouldn't be the primary mechanism in which you experience the allergy, so maybe it makes no sense. I don't know. I just wonder if there's a way to do that. I don't know. Could you inject yourself with something related to peanuts, for instance, and do it that way? Could it be administered that way? But you're saying sublingual is what the preference is right now, so that's similar to the route by which we get the allergy.
Okay, the chance of having a reaction to any food or anything by injecting is a lot more compared to taking it orally. Even if it's an IV antibiotic or an oral antibiotic, the chance of having a reaction when you're receiving IV is higher compared to taking it oral. And also, tolerance to food or anything can be, let's say you're inhaling something, pollen allergies. So we don't necessarily do the immunotherapy through inhalation mode because that can build allergies. As opposed to that, if we inject the allergen, the immune system perceives it in a different way so that it can build tolerance. It can train a totally different set of cells to develop tolerance. And that's what is the idea.
Yeah,
The way it is
which
presented to the immune system matters the most.
well, forget my bad idea of injecting, but yeah, yeah,
No, that's a good question. You're asking also smart questions.
but beyond that, are there like which cells in the body tend to be the best reporters to other cells and to help build, immunity to a given insult? Are there certain cell types identified, or does it just depend on the allergy? Or
So there are cells, antigen-presenting cells. They are called dendritic cells. They anything that we eat, they are presented to the immune system. So there is a crazy amount of detailed reactions happening in the immune system. Why in some, it depends on what kind of chemicals are released. Cytokines are released. Cytokines are some kind of messengers. Depending on what type of messenger is released after you ingest something, specific cells are attracted to the area to cause the allergic reaction. So to answer to your question, there are different types of cells which present the allergens or an antigen to the immune system, but having a reaction or not is genetically predisposed, and epigenetics also play the role. But there is, like, at the molecular level, the crazy amount of things happening in the immune system.
right, that's true. Any breakthroughs that are being tested right now that seem to hold a lot of promise that we may see clinically soon that you think are important, and why?
In terms of allergies, one of the things that are being, more and more things that are coming these days are biologic medications. These are the medications which specifically act on certain molecules. For example, asthma. Asthma, there are different types of asthma phenotypes. Whether it is one type of cell called eosinophilic pathway, which causes asthma, or allergy pathways. Allergy antibodies are IgE antibodies. So we have antibodies that block the IgE antibodies. For example, an injection called Xolair or omalizumab. This is designed to block IgE antibodies. There are a wide variety of anti-eosinophilic antibodies that are being developed. The exciting thing is that we classify asthma into different phenotypes, whether it's an allergic, non-allergic, eosinophilic, non-eosinophilic, and we can pick and choose these monoclonal antibodies or biologic medications. So that's actually exciting, and we have more to come in the next few years. And that's exciting about treating allergic disorders. And when it comes to immune deficiencies, there are other cool things that are being developed as well. We haven't talked much about immune deficiencies, but so far for allergies, it's the advances in understanding the molecular basis of how the immune system reacts to various allergens, and specifically targeting certain molecules is the exciting part right now.
Well, what happens typically in an immune reaction right now? Let's say, food allergy. Why would someone's throat swell closed? Why would they, have this such severe reaction? Like, what's going on, biologically with them that causes these problems?
When you're having an allergic reaction, to overly simplify, mast cell and basophils are the allergy-causing cells. So they store different types of chemicals, most commonly histamine and tryptase, and these are the chemicals that are released, and various types of prostaglandins are released from the mast cells and basophils. These chemicals have various functions. They enlarge the blood vessels. They make the blood vessels more permeable. There is oozing of liquid from the blood vessel. So these are the things that give rise to flushing and itching and swelling of the local area. If the swelling occurs on the skin, it's called angioedema or skin and the underlying tissue. You could get hives or angioedema. If the same thing is happening in your throat, which causes swelling, it may cause swelling and sensation of throat closing and shortness of breath.
Well, very good. Lahari, what do you think is going to be possible in the next few years? I mean, do you think that yes, maybe there's new treatments coming, but is the allergy situation worse now, or is it kind of the same as it always was? I mean, I know it's probably changing, but do you see that we have to hurry up and get some better science to treat these things because they're growing, or like what's your overall feel?
So overall, the allergies have increased. Whether we are, I don't know whether it is because we are diagnosing and are able to find more patients, or whether it is climate changes leading to more allergies, or whether it's hygiene hypothesis. We don't know, but allergies are on the rise. I think scientifically, I mean, in terms of finding treatment and understanding the pathways, people are doing amazing job. But I think one of the biggest challenges is that it's impossible to prevent or completely stop the allergies from occurring. It's important to understand the molecular basis to treat them better, but it's not. I don't think you can completely prevent allergies. There are certain measures that you can take. There are also studies to show that by early introduction of food in infants, you can actually prevent allergies, especially in high-risk children. Those are the things that we are able to better understand, but I don't know if there is a way to completely prevent or treat or resolve allergies once they develop.
Yeah. And I should have asked you at the beginning, why is this important to you? Why do you study allergies and things like this? Is there an unfortunate personal circumstance that's governing this, or like?
So when I studied in India, I went to med school in India before, coming for residency to the US. So I worked in an underserved area where I used to come across a lot of allergies and immune disorders, kids with immune deficiencies, but we didn't have any resources to treat them, diagnose them, or do further. But when I was doing my residency in New York, I had a chance to rotate in Albert Einstein University Allergy Department, where I came across wide variety of complex cases of allergies and immune deficiency. It was fascinating to me. I was totally blown away by the kind of variety and complexity, and that's how I got interested in allergies and immune deficiencies.
Okay, great. Well, how do people find out more about you and your work? Where can they go? Is there a website, or they Google you? What's best?
They Google me. I know I'm associated with University of Washington, and there are things that we do. It's there in the website, and that's how people get to know me overall.
Okay. Well, very good. Lahari, thanks for coming. I appreciate it. And I know this is a problem, and I have asthma myself, and I've experienced allergies, and probably everyone listening either has or knows someone that has experienced this stuff. So it's not alien. It's very pervasive. So thank you for being here. I appreciate it.
Thank you for inviting me and giving me this opportunity, Richard. Happy to be here.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.